What's poppin', y'all? Welcome back to Pop Health, and today we're talking about the Kaiser Permanente strike, one of the largest healthcare strikes in the history of the U.S., as well as how can it affect your health. And so, if you're not familiar with Kaiser Permanente, basically they're one of the largest healthcare system or nonprofit healthcare systems in the U.S. And while they're based in California, Oakland to be specific, they have medical campuses in L.A. as well as in the District of Columbia, as well as in 8 other states and all that. And so when you tell them this is a, organization that employs, thousands and thousands of people, them going on strike is a big deal because about 75,000 of them have went on strike today, or not today, Wednesday. So one of the biggest things that people are wondering is that why are they going on strike? And pretty much that is because of usually costs or, pay, as well as staffing shortages. So just going on pay alone, basically their demands are that they are paid about $25 per hour, or raising that minimum wage to that amount to all healthcare workers. Now, to be at least bit fair to Kaiser and their corporation, basically they did offer to try and get like a 12 to 16% increase over the next 4 years, but obviously that will probably not be enough to really keep up with the cost of demand, especially since most of their employees are based in California. And really give you a basic snapshot about how much nurses are paid when it comes to Los Angeles alone. They're paid about 46 dollars an hour. Now a lot of people might think that's a lot, especially depending on where you work, but you need to realize this is talking about Los Angeles, which the cost of living in Los Angeles has skyrocketed, especially in the past decade. And so just to even talk about just living, as an adult, you need about $21, to live, comfortably as an adult. With children, especially if you're a single parent, you need about $44 to even take care of the family. And even when you talk about two adults that are in the house working, you need about $24, of hourly income for both adults to be able to take care of the family and all that. And that's just one child. And I'm a big proponent that, you shouldn't be having children, until you're ready. You need to have better family planning. I think that family planning system and how we talk about families in the US need to be changed. But obviously people want to have families, people want to have children, people want to be able to, live that white picket fence, lifestyle. And they cannot do that with the current wages that are being presented in Los Angeles, because I think the current wage limit for LA or California is about $21. You can't even take care of one child with that, with both parents working. Like, let that sink in, y'all. And while nurses do generally make a better income than most professions in the US because of just how much you need a good nurse, you're willing to pay for like a good nurse, that is still not going to be able for a person to comfortably take care of a family, even in LA and Los Angeles, because, a lot of these, indicators, especially when it comes to like salaries, they don't include how much taxes you have to pay. And it's just that all that really do put a lot of stress on you as an individual, and not even just as an individual but as a family unit, to take care of one another when you don't get as much pay. And another reason why the pay is such an issue is that you got more nurses taking on more responsibilities and more patients than usual, because another big thing that they're trying to strike for, demanding for Kaiser to figure out and fix, is the staffing shortage. Basically, we also were facing a staffing shortage before 2019 or 2020, whenever the peak of pandemic, or the start of the pandemic actually happened. And so people were already stressed out, burnt out, and all that, and were quitting even before the biggest health crisis we've seen in a century took place. Now, as we are in year 4 of this crisis, about 4 million medical care workers left their jobs throughout the pandemic, and it has really stressed out the situation with the people who are still there, because now you're having more ratios for healthcare providers and nurses and all that, where they might see for example 5 people per night, you got them taking care of 10 people and 15 people, or like just abstract numbers. Obviously this not happening in most cases, but you get my drifts. Basically you're taking on more workload for the same amount of pay that hasn't really increased, for the past few years. But to also take into effect, this is one of the most stressful jobs you can do, because you're not only taking care of people and trying to save people, but at the end of the day, people are going to, pass away. People are unalived on a daily basis due to a number of things, chronic conditions, old age, as well as we still have a pandemic happening where people are still being unalived for a lot of reasons. And so it's a stressful job. It's very taxing mentally. And I understand why a lot of people, decided to retire or quit during, the past few years, because it's not worth it for a lot of people. And so what the demand Kaiser is that they need to hire about 10,000 new healthcare workers to fill these current vacancies. And to really just understand how much this is a big deal, Kaiser is one of the biggest medical employers in the nation. Like, they employ about 70,000 nurses. They employ about almost 215,000 technicians, clerical assistants, administrative staff, and all that. And just alone about 24,000 doctors, as well as serving about 13 million, people across 18 different states, including District of Columbia. Like, this is no small, thing that's happening to like your little clinic across the street. Like, this is a big, strike that is taking place. One of the largest strikes, and even the largest strike that is taking place in healthcare history. And it really hits on the point that, these workers are overstressed out and really are, needing help and needing more assistance. And really just to continue to highlight how big this issue is, when it comes to employee and basically, staffing hospitals, there are a lot of employees that cannot afford to live in the cities that they work in, especially, Los Angeles with its high cost of living. And this is causing them to sleep in their cars because oftentimes, they don't want to commute about 1 or 2 hours away from the city, every day, and having to do that, 5 days, 4 days, 7 days out the week, or how many days they work. And basically, when you're working about 14 to 16 hours days, as stated anecdotally right here, you want to basically, have some type of convenience. And so a lot of times they sleep in their cars. Like, can you imagine that you're talking to a nurse or you're talking to a physician? Well, not really physician. I think physicians are a little bit more well off. But basically, you're talking to a nurse or a healthcare worker basically in charge of taking care of you, cleaning your room, making sure you got what you need, and you find out they're sleeping in a car. Like, would you have confidence in them as a worker? Not really on a worker, but more just like how things are run here. Would you have confidence, in the care that you're receiving is the optimal care that you're getting? And so, that's something like, why a lot of these people are going on strike, because it has a good chance of affecting your care. Because if you have a burnt out physician, you have a tired physician who just woke up, from sleeping in a car for only like 5 hours or 4 hours, whatever, then it's just like it could lead to mistakes and it could lead to a lawsuit or get someone getting sued. And speaking of what this means for patients, and I think one of the biggest questions y'all want to ask, like, how does this affect healthcare or like the quality of care that is being given to patients right now? And so just to look at this article alone, basically some of the services that are being affected are labs. Basically a lot of labs and or some labs or some tests are going to be delayed. Services like imaging and filling prescriptions, especially in pharmacies, are also going to be delayed during the walkouts, as a lot of pharmacists are walking out due to the strike. Hospitals themselves are going to be open, and usually when there's a strike, a lot of times it's voted on by a union, and they let the corporation know, so that way they don't just be slashing people jobs and all that. But pretty much they will often hire temporary workers to be able to fill out the void while the strike is going on. And basically, hospitals are still going to be open, healthcare facilities are going to be open, especially emergency care centers. There could be a real chance that some people are often directed outside of the network to get their healthcare needs, especially if it's deemed necessary, especially if it's an emergency. But there's a greater chance that some people are going to have to seek care somewhere else, or they're directed outside the network to seek care, especially since there's this disruption due to the strike taking place. Even the little things such as your room getting cleaned, as well as like food being prepped, what is how the hospital is running, operating, all that, even the technical side of things, that is going to be affected by the walkout. And even though, like I said, they can bring in third party contractors, or they can bring in other resources to fill out the void, at the end of the day it's not going to run smoothly, as you have workers who are actually salaried and working there, who knows the system, you just can't replace that with just a temporary worker that's been across, other different systems and networks and all that. Basically, I am in support of workers going on strike, because for us yelling, screaming from the roofs, oh, they essential workers, we need to take care of them, pay for them, give them appreciations, whatever. Here's a cookie, thank you for doing what you do during the pandemic. To about a year later and leading up to now, expecting workers to continue to work and work and work, especially during the pandizzy, basically, stressed out, burnt out, and just in fear for their lives and loved ones' safeties and all that. I think they should get better benefits. And really, corporations really need to be thinking about all the work they have done, because literally the society would have been on brink if all workers really just striked. The WGA as well as the SAG was striking. I think the WGA was able to figure it out. The SAGs are still like trying to work out a deal, and they're still currently on strike. Auto workers on strike right now. Healthcare workers have also been on strike in the past year. I think the most recent one I'm familiar with is the Ascension C10 strike that took place in Austin. And the great thing about this too is that these strikes are not going to stop happening, because as seen with the UPS success that that strike had, a lot of people are now more motivated to advocate for their rights now, and as they should, because at the end of the day, the benefits going to be long lasting and they're going to affect a lot more people. And even though you can't see it right now, I think this is a good thing for America and for other workers in other industries to step up to. So that being said, that has been Pop Health. Thank you for watching today. If you like what you see today, like, subscribe, comment, all that wonderful good stuff. If you like this video, you might love my video I did a few days about Kevin McCarthy and like how the speaker situation is going to affect America and our health. So definitely take a look at that. Other than that, stay warm, stay frosty, depending on what part of the country you're in, and peace out.